Processing Health Crisis Semiotically. This is a talk contributed to the first Health Crisis and Education Conference, hosted and organized by Hedra, the 7th to the 8th of July 2021. I'm Christian Matthiessen, and I'll present this talking to you for the next half hour or so. Welcome to my talk on health crisis and education, specifically on processing health crisis semiotically. That involves, in a sense, turning our experience of health crisis into meaning, whatever the source of experience is. I'll begin by characterizing health crisis. Then I'll talk about two aspects of the complexity of health crisis, because they're very complex, like crisis in general. And then I'll come back to the notion of processing health crisis semiotically, suggesting considerations of how we construe our experience of health crisis, but also how we enact the information about this, and importantly, the validity of this information, separating out what's valid from what's fake. So let me start with the notion of crisis. Crisis. One thing that occurs to me when I hear the term crisis is a classic film from the early 50s with Cary Grant and José Ferrer as a main character. It happens to be an interesting illustration of the manifested nature of crisis. It involves both a health crisis, a crisis of conscience, and a political crisis. It starts out with a lovely couple on a honeymoon to countries somewhere south of the US. But the honeymoon set off a national crisis. Now this picture illustrates the interconnectedness of crisis. And in fact, if we look at crisis in general, we find them in different complex systems. We find, for example, social crisis in the system of economy, finance. We find them in biological systems, health crisis, and that's of course our focus. We find them in physical systems, or physical and biological systems, so material systems, climate crisis, involving, for example, the interconnected system of our planet, Gaia, in James Lovelock's conception. And what I will lead up to, crisis looked at from a point of view of meaning, semiotic crisis. That may, for example, have to do with information load and the validity of information. So for overload of information, and then the challenge of assessing the validity of this information. Now, as a starting point, we can look at the Wikipedia characterization of health crisis. So the entry says, a difficult situation or complex health system that affects humans in one or more geographic areas, may occur in natural hazards, from a particular locality to encompass the entire planet. Health crises generally have significant impacts on community health, loss of life, and on the economy. They may result from disease, industrial processes, or poor policy. Its severity is often measured by the number of people affected by its geographical extent, or the disease or death of the pathogenic process which it originates. So various things are captured here. but importantly, the complexity of a health crisis. So let's ask how a health crisis, or any crisis, is complex. One aspect of the complexity of crisis, including health crisis, is that they tend to affect more than one order of systems operating in different phenomenal realms. So it may be both a physical crisis and a biological crisis, for example, as in the case of climate change, global warming. So I'll say something about this, separating out the different orders of system and suggesting the way in which complexity spreads or involves interacting factors from different orders of system. Another aspect of the complexity is the question of when does it emerge? How do we recognize it? So emergence from instances, if these are catastrophic, there's no, in some sense, problem in recognizing a crisis. But we also have to do with creeping crisis, slow crisis. But let me take the first aspect of complexity to begin with. I'll magnify this diagrammatic representation of systems of different orders in a little while. But let me just name the different orders. And they're represented here in increasing order of complexity. First order systems, physical systems. Physical systems that are also plus life, living systems. Biological systems, these are second order systems. Then biological systems that have some additional property, we can call that value or social order. These are social systems, third order systems, where, say, for example, biological populations are also social groups, possibly forming societies. And individual organisms take on different roles in different social networks, different persons as aggregates of personae or social roles. And then finally, in this ordered system of complexity, systems that are social systems, so have value, with persons in social groups playing different roles, but one other property, meaning, or if you prefer to put it in cognitive terms, knowledge. But they're just different ways of looking at this higher order complexity. But I'll stay with the perspective of these systems as systems of meaning, carrying or creating meaning. And systems of meaning are semiotic systems. So these are fourth order systems. So when I talk about the processing of health crisis semiotically, I'm focusing in particular on fourth order systems, systems of meaning, semiotic systems. So the background for this interpretation is this ordered complexity. It corresponds clearly and also by hypothesis to order and cosmogenesis, that is the order in which these systems emerged, starting with the Big Bang in physical systems, then billions of years later, the emergence, as far as we know, in one place in the universe under very complex physical conditions, life, on the order of 3.5 billion years ago. And then on different occasions, social systems out of biological populations, and finally semiotic systems within social groups, societies. Now, once a new order of system has emerged, it will develop together with low orders. So once, for example, biological systems have emerged, and also social systems, they will co-evolve. And similarly with biological systems and semiotic systems, they will co-evolve. And leading scholars like Terry Deacon have suggested that the explanation for the extraordinary complexity of the human brain is that it has co-evolved with language. And to that we can add observations by Robin Dunbar, for example, the co-evolution of social systems. So that's the overall picture. And the increasing complexity then is from first order to second order to third order systems to fourth order systems. And they're also more complex in the sense that fourth order systems are also third order systems. And third order systems are also second order systems. And second order systems are also first order systems. Now, if we think about health crises, we probably think of second order systems in the first instance, biological systems. And so we ask, what can go wrong with biological systems? Well, one aspect of this is, of course, some form of disease. Now, different forms of disease may or may not lead to a health crisis. So one common contrast is between communicable and non-communicable diseases. Either could lead to crisis, of course, but in different ways. Communicable ones precisely because they're communicable through social patterns, overlay biological patterns. And it depends on how these communicable diseases are communicated, how transmitted. But non-communicable diseases may also lead to a health crisis, of course, because of environmental conditions, lifestyle changes, and so on. So if you want to explore this in more detail, we could look at this in relation to types of disease. The ones I mentioned are both acquired, communicable, and non-communicable, but also congenital diseases. Now, this is complex enough, of course. But the additional complexity that I already foreshadowed is that systems of different orders interact. So physical, biological, social, also semiotic factors interact, and they may interact to increase the complexity. And to do something about this, to find a solution to the problem of a health crisis, we need to understand this interaction, and we need to understand the different systemic aspects of it. It's just one example. It comes from a paper from last year, the title of which is "Climate Change is a Health Crisis. How can healthcare and life sciences respond?" So that's a very important point. It's an interesting paper to read. And as an illustration, let me magnify one of the diagrams they provide. So they separate out three kinds of factors: climate hazards, health determinants, and health outcomes. So in a way, this diagram is to be read left to right. So you start with the largely physical crisis of climate change, climate hazards. Then you move on to health determinants that may involve physical factors, but also certainly health factors, so biological factors. And then biological outcome, health outcomes. This is just an illustration of a way of approaching the analysis and the deconstruction of health crisis. So in other words, there are multiple interacting physical, biological, and social factors. So if you're looking for an explanation, it's likely to be a factorial explanation, so a multifactorial explanation. But in the light of our conference, we would of course add one more factor, or class of factor rather, and that is of course semiotic factors, not identified in this diagram. But they can be very important in allowing us to detect a crisis, but also in the way they can feed back to the crisis. So the way that the flow of meanings, as it were, can affect social factors. So we can relate this again to the orders of system, and we could go through the factors they identify and locate them within the different orders of systems, as I suggested very briefly. So physical factors, biological factors, social factors, and then we'd want to add in our analysis and our account semiotic factors. So that's one aspect of complexity. of a health crisis. Not only the complexity within biological systems, but also the way they interact with factors within physical systems, within social systems, and importantly also within semiotic systems. So, for example, in response to COVID-19, one aspect of the crisis is precisely that people find it difficult to get clear, authoritative information about how to proceed or what is actually happening. And that's been a concern expressed in different places around the world. It's very difficult to get a coherent, consistent account of the nature of the COVID-19 health crisis. Another aspect of the complexity is that is potentially very difficult to detect. Now, if you have a catastrophic crisis, then it will be clear enough because it's very sudden. But many crises are creeping crises. So the creeping complexity and the question of when we began to see that it's systemic enough to recognize as a crisis. And that indeed we've experienced, of course, with COVID-19. Recent items in the news, like the collapse of the building in Florida, where it took too long to recognize the signs, the indications that reached a tipping point, the tipping point being the collapse of the building. But there are lots of examples of this kind. So challenge in instantial patterns emerging as crisis and the challenge of recognizing this. Let me give just a very simple example. Crises, of course, come in many kinds, but whichever orders of systems are involved in crisis, one general question is, when do we recognize that we have a crisis? And how fast-moving is the change that leads us to the point where we recognize, all right, this is a crisis. So if you take a physical change like this, by the time you have a fire that engulfs a whole house, a whole village, you certainly recognize that there is a crisis. But there may have been smoldering embers for quite a while before you got to the point where there was a real crisis, maybe too late for the fire brigade. So that's one of the challenges in dealing with crises, detecting them. And that is partly, of course, a material challenge. The instruments needed to detect whatever the indicators are of a crisis that is emerging. Also social in terms of the organization that's needed, the agencies, the teams and so on. But at the same time also semiotic. When do we detect a crisis? What are the crisis ways of reporting or monitoring? All these are issues in the complex interaction of different systems in different kinds of crises. Let me take an example, again, something fairly recent, this is 2019, from a domain that we've become very familiar with, the climate. The climate is, of course, you could say in the first instance, a physical system, and is precisely a system along the line of instantiation where we're familiar with, we meet it every day as instances of climate, that is weather. And one of the challenges over the last few decades has been to recognize that global warming is not just a series of blips in the local weather, but is actually a systemic change. So that's a question of recognizing that systems emerge out of instances, or that we can recognize systems out of instances. And that's precisely what the title of this article is. recognizing the climate crisis through focused journalism in Pittsburgh and around the world. And they start out, or Hal Stockton start out. Where were you when you first heard about, and then insert tragic event. We all have stories and memories of the biggest crisis of our time. Usually it's a specific moment seared into our minds. I'm sure many of you were recalling one recently on the 18th anniversary of September the 11th terrorist attacks. I know I was, and so on. These types of crises spring upon us and demand global attention immediately. There is such a thing as a slow crisis, one that creeps for years, even decades, and has the capacity to harm even more people over even more time and change life on Earth as we know it. The creeping crisis of our era is climate change, and it's not slow anymore. So this notion of creeping crisis. We, the collective residents of this planet, have been issued some deadlines in the past year for changing our ways, and those dates are no longer generations removed. In October, a scientific report by the Intergovernmental Panel on Climate Change warned of catastrophic effects from rapid global warming, and so on. Are you all familiar with this? My point is simply that this is a clear example of the kind of challenge we find in recognizing health crisis, or crisis of any kind. The notion of slow changes that in turn out to represent a creeping crisis. And we can ask how we detect this in volumes of text. Here I'm using Google's Ngram Viewer. Just for 3 terms: health crisis, climate crisis, global warming. And this is over a period of about 30 years, 1980 to 2008. And here is fairly clear. You can see by mid-80s, if we were monitoring just mentions of global warming, we might begin to become aware of it. If we then look at the period 86 to the next decade or so, we see that the change in increase in frequency is more rapid. Then maybe it levels off a bit, but it continues to increase steadily, and now looking at about a decade ago. If you compare health crisis and climate crisis, they hardly register. But that's one of the challenges. It's not that they weren't mentioned, it's just in comparison with global warming, they were much less frequent, and the change in frequency much less noticeable. And we get the same effect, say, if we use another tool provided by Google, Google Trends. And I've just taken the terms health crisis and global warming as search terms, not as topics, as search terms, over a short period of time, July 2020 to the present. And you can see again, global warming actually dominates over health crisis. Now, I haven't provided you with any search terms having to do with the current health crisis, COVID-19 and so on. That was a topic of a previous conference, as specifically the current pandemic. But these are ways in which we can explore how people react to this semiotically, searching for terms or topics. And we can break it down to regions, to countries, and we can see where the concern is. So this is one way of exploring it. And it's picked up in a discipline or a suggested discipline called culturomics, including a team of people behind the Google tools. Now, returning to Google's Ngram Viewer, if you remove global warming as something that dominates, you can see that there has in fact been change in mentions of health crisis. Quite unhealthy ones in the sense that they've increased over the period from 1980 to 2008. So that's another aspect of the semiosis of crisis, monitoring, detecting, changes in uses of terms that may indicate something having to do with the health crisis. If there are other motifs that dominate, the ones that we should be paying attention to, the ones that are perhaps creeping up on us, may not be noticeable. But terms like health crisis, global warming, are of course only the tip of the semiotic iceberg. And it's important to be aware of this. It's important to be aware that they may be indicative, but there's much more to what we could say crisis in modes of meaning. I mean, either in the way we talk about things or the significance of these in terms of what's happening. There's a recent example, very recent, having to do with construing health crisis, specifically COVID-19. This comes from a great colleague, a very good friend, Elena Semino at the University of Lancaster. And she contributed a very important, interesting opinion article to The Guardian in the last week or so. And the title is Fire, Waves and Warfare, the way we make sense of COVID. And the way she approached this was through her research, using corpus methodology, focusing on lexical metaphor, or what cognitive people tend to call conceptual metaphor, but it's really lexical metaphor. So lexical metaphor to be complemented by studies of grammatical metaphor. So the overall area is really lexicogrammatical metaphor. So she starts out her piece saying, an enemy, a mugger, a tsunami, a fire, a race, and even glitter that gets everywhere. Just a few of the metaphors used to describe different aspects of the COVID-19 pandemic since it began in early 2020. And then she talks about this in more detail. And at the end, I mean, she has done research into lexical metaphor in different aspects of health, including terminal illness, cancer, for example. And she concludes this very important contribution saying, metaphors are inescapable. Used sensitively and appropriately, they can help individuals and societies overcome overwhelming long-term problems, such as a global pandemic. But used insensitively or inappropriately, or when undermined by inconsistent actions and policies, metaphors can add to confusion and disillusionment, making problems harder to overcome. In short, to employ another metaphor, they can be a double-edged sword. Point well taken. Now, by paying attention to lexical metaphor, we get more of the picture than just terms like health crisis, global warming, COVID-19 and so on. But even lexical metaphor are in fact just part of the iceberg, a bit more than the tip. But what we really need to monitor, detect and work with are motifs in modes of meaning around emergent or current crises. So that would be a long-term topic to come back to. This is of course to do with how we understand health crisis, but complementary to models construed, sort of an ideational aspect of engaging with health crisis. It's a question of the validity of information. That's more interpersonal. And the two together, in fact, are very important in the semiotic processing of health crisis. Both how we model our experience of them, ideational, where lexical metaphor plays a significant role, but also how we assess this information, the validity of information. And of course, we're increasingly familiar with this through notions like fake news, false accounts, misleading accounts, and so on. And let me give you another example that is helpful in thinking about this. This is from last year. And the title of this, First Corresponders. So not first responders, but first corresponders. 3 reasons why a free press is crucial during a public health crisis. USAID champions media partners on World Press Freedom Day. And here are just a few snaps from this article. If you look at the one to the left, it says misleading, news, media, networks, providers, responsibility, ethics, working, buzz, hoax, and so on. So these are kind of lexical semantic motifs that emerge in the meta-news, as it were, news about news, or in contestations, debates about the interpretation or the policies relating to COVID-19. So the caption here is, in an era of increasing information pollution, the spread of disinformation has intensified in the face of the COVID-19 pandemic. So notice here, of course, the lexical metaphor of information pollution. So taken from discussions of the environment. We've also heard about lexical metaphors treating this as some kind of communicable disease. So a virus of false information or fake news, etc. And this is related to what Michael Halliday talked about a decade and a half ago, about the danger of the destruction of knowledge. Or this other image I showed before, it says USAID's partners in the Philippine fact-checking information to debunk false claims surrounding the coronavirus. So fact-checking has become a very big activity, important activity. And that, of course, relates to the increasingly large volume of texts that wash over us. So notions having to do with this, concerned with the validity and concerned with the angle of approach to the information, creating the information, disseminating the information that reaches us. So go to the source, and if it's images, problematize the way it's been cropped and contextualized. So does this picture really tell the whole story or not? And ways of detecting hoaxes, types of misinformation. So fact-checking is something that's become very familiar to us, including, of course, what we might call semiotic bubbles, where people only access text from certain sources and shield themselves from other sources. And the way that social media or cable news has played a role, in particular Fox News. Michael Halliday suggested years ago that this was very appropriately named news organization, Fox News. This may be, of course, by chance. People just haven't got access to information, but very likely there is a systematic selection, a stance taken, a systematic selection of meanings to be included and excluded. And that's something that our friend and colleague Anna Balukin has addressed in a recent book, War and Its Ideologies, a social semiotic theory and description. And very similar considerations would apply when we think about the semiotic processing of health crisis. So this very important issue then of the quality of information in large volumes, fact-checking. And in a previous Hedra talk, we discussed this. And as far as health is concerned, of course, the World Health Organization, WHO, is important. And they use another lexical metaphor that I hinted at before. Let's flatten the infodemic curve. So we can talk about this in terms of pollution. We can talk about it in terms of epidemics, pandemics. It says we're all being exposed to a huge amount of COVID-19 information on a daily basis, and not all of it is reliable. So the validity issue. Here are some tips for telling the difference and stopping the spread of misinformation, the destruction of knowledge about it. And they have a number of topics one can go to. Mythbusters. So that's a very important contribution and a crucial aspect of the semiotic processes of health crisis. let me conclude very briefly. I suggested that a health crisis, like many other crises, is very complex. It's very complex in terms of the orders of systems, in the sense that it's, while we may locate it in the first instance biologically, although it may be physical, having to do with pollution of the environment, in the way we engage with it, we have to engage with it also socially. I haven't said much about that, of course, and semiotically. And I've tried to say something about the semiotic processing of health crisis. There's the issue of awareness, the issue of becoming aware of creeping crisis, and of casting the reading or listening net wide enough that we pick up information, we detect meanings that may not be very prominent on the front page of the news sources of powerful nations, powerful languages. So that's very important, the issue of awareness. But I spent some time talking about the modes of meaning. I talked about the construal of crisis, terms denoting a crisis or aspects of a crisis. And we're aware of them because they're easy, relatively speaking, to trace and monitor. But as I put it, they're only the tip of the semiotic iceberg. So they're lexical metaphors, like the semiotic iceberg, and they give us more of an insight. And as Elena pointed out, they may help us understand, but they can also be potentially misleading. So we have to be critically aware of them and reflect on them. But again, they are a very small part of the picture overall, and it's really a question of the models of construal of health crisis, all the meanings involved and all the texts in their context. And then finally, I said something about, once we've construed these models conveying information, how is the information enacted, the validity of information. Is it open to examination? How is it assessed? Is information conveyed by experts or folks in their basement just guessing about it? Are there built-in biases, as in Anna Balukin's study of the news coverage of war? So these two combine to form two very important aspects of the semiotic process of health crisis. I haven't touched on a third consideration, and that's, if the first is ideational, construal of crisis, and the second is interpersonal, enactment of information as people exchange meanings about this, the third is the textual metafunction. What's picked out, for example, as newsworthy? What's treated as given? What is given prominence as the orientation to whatever text we meet about health crisis? Thank you very much.